All right, good afternoon, everybody. Here with Josh and Paul and two special guests I'm looking forward to introducing in just a minute. Very quickly, let me just give you the update on where we are in COVID. As we have for the last 3 days, we continue to be at under 1%, so that's all good news. And we're averaging over 100,000 tests a week, 14,234 as of yesterday. And this is important, these numbers, because, we've heard about Danbury. I'm pleased to announce that the infection rate there has gone from 7 down to about 3.5%. We still have a way to go. You probably heard a little bit about the Norwich Nursing Home, Bacchus Hospital, track and trace. We're following that very carefully. And we're going to be talking a little bit about UConn, because I really am focused on the colleges. I've seen what's happened in colleges around the country, Notre Dame and Alabama, and we want to make sure that here in Connecticut we can open our colleges safely. With that, let me just say a little bit about school and getting back to school. And I was really proud to see the Connecticut ranked number 3 in the nation in Education Week. It's based upon the quality of our teachers and the success rate we have in terms of graduation and going on to, in many cases, a great college or a good job. And this is why I so prize education and make a priority of getting kids back to school safely as quickly as we can. And with that, I know the concern we have, given COVID, given potential for flare-ups, given questions about testing, what can we do about it? I don't feel like my school is 100% prepared. What am I going to do? Well, Josh and Deirdre, heard some of those broad-based concerns. Obviously, we've been working on this for months. I think the overwhelming majority of our schools are ready to go, and we're there to help them, not only by providing all the masks and disinfectant and everything they need to operate safely, but we've all now put together a rapid response testing team. And they're going to be able to get to a school really fast in case of a potential infection, if the school's not quite sure how to handle that. Be it a school, be it a college, be it a child care facility. And we're going to be partnering with our federally qualified health centers all over the state and hospital systems, bringing in this mobile unit, as you can see from the picture, been able to test people very quickly, give them some confidence of where they stand, and help them in terms of quarantining, surge testing, and keeping students and teachers safe. And we're going to be working very closely with the local health officials to make sure that we can get this right. So I think this is one more level of security trying to provide for teachers and parents. And my team gave me a little bit of grief about this one, but I got a kick out of this photograph. It was on the front page of the New York Times. And it just gives you an idea of around the world how hard people are working to get their kids and young people in high school and college back to school. And this is a former soccer stadium. They've retrofitted it now, kids taking a test. And it's not in Hartford. It's not in Italy. It's in Uzbekistan. And there are thousands of kids lined up here outside where it's so much safer, doing what they can to stay safe and to continue learning. But with that, I know we've got Labor Day weekend coming up, and I think I want to reiterate, one of the places I always look at with care is our colleges, because you've seen the potential for a flare-up there, and some colleges that opened had to change direction, not in Connecticut, but elsewhere in the country. And we've got two amazing guys here, coaches, basketball coaches, the men's basketball coach and the women's basketball coach, who know the students, who know the scene at UConn, and know what it means to be on a team, know what it means to be a team player, and know what it takes to be responsible as we go through this weekend and do everything we can to open up UConn and our other colleges safely. And first up, I'd really like to introduce Dan Hurley, the amazing coach of the men's basketball team. They've been practicing now for some weeks, no infections. They're doing it carefully. And Dan, what do you have to say to the people of Connecticut and the students of UConn?
Yeah, Governor Lamont, thank you. Thanks so much for having me today. And thank you for all that you've done and will continue to do in order to keep the state of Connecticut safe, throughout this COVID-19 pandemic. It's been awesome. We've been here, really since June with the team when there are no students on campus, with the exception of the basketball team. But just having the students back right now, there's an amazing energy, that is back in stores. So the students have been, and it's great to have the students back. Students have been on campus for weeks now, and the classes have started as well. But we've got to remain vigilant, and disciplined, with our behavior and with following the guidelines. Hey, Huskies, this is not the time to get complacent when it comes to wearing masks or social distancing practices, or being smart about the choices we make in terms of hygiene, and protecting those most vulnerable. When you get to a friend's house, are you being smart, or are people wearing masks? Are you socially distancing? The students, our Husky students, is such an important part of all of our athletic programs, obviously, especially basketball. The connection, it's special. And the more that we all follow the guidelines, the more that we all follow the rules, the sooner college life will, get back to feeling a lot more like normal. I know our team, and I know Gino, feels the same way. Like, our program thrives on the student excitement and involvement in our program. And we want you to be able to root on your beloved Huskies as soon as possible. So be smart this Labor Day weekend. Don't be complacent. Don't let up. Don't relax. Follow the guidelines. Be disciplined. And remember, we're all on the same team here. The Huskies are Connecticut's team. So let's act like it, and let's all get through this together.
Hey, thanks, Dan. We're all on the same team. I love that. And be smart. Stick around for a few minutes if you can. But I'd like to now introduce somebody he was the winner of our If You Have to Ask, Wear the Mask. Go.
People ask me all the time.
Oh, geez,
Gino,
man.
do I have to wear a
Hey,
mask?
look, I don't have anything to say, Governor.
One second, Gino.
How can you
But
say
it's more than that.
better than the way Danny just said?
Gino, we're playing your video.
Oh, my God.
1 sec.
Seriously?
One sec.
People ask me all the time, Gino, do I have to wear a mask? Yeah, you got to wear a mask. I mean, they say defense wins championships, but it's more than that. It's about being together. It's about being unselfish. It's about being a great teammate. So do the right thing, and you might get 11 national championships. You probably won't, but wear a mask.
Gino, you know how to rub it in. What do you say, my friend?
How you doing? All right?
Hey, we're doing good. And you just heard Dan give young people a bit of a pep talk on what it means to stay safe and be smart. Love to hear your thoughts as we look. Connecticut's winning right now. We're winning because we are being smart. We got to keep it up, though.
Well, I think Danny said it about as well as it can be said. When you look at every time you pick up the paper, every time you watch something come over the air, there's another school that's having this major crisis, whether it's 1,000 students or hundreds and hundreds of students and being sent home, and I think the example that's been set here in Connecticut, and obviously a lot of the credit, Governor Lamont, goes to you and your administration because you set a good tone. I think every good team needs leadership, and when you lead, and you lead with a sense of urgency and a sense of directness, and you say, this is what we're going to do, this is how we're going to do it, and this is how we're going to get through it, then people believe in that. People listen to that. And I think what's happened in Connecticut is a model for the rest of the country. That if you do it the right way, if you listen and you have good leadership and you're all in this together and you believe in each other and you trust each other. This is one giant game of trust. I have to trust that you are going to do the right thing. And then you have to trust me that I'm going to do the right thing. And we all have to understand that we are responsible for each other. So nowhere is that more important than on a college campus. Kids go to college because, one, it's an experience of a lifetime. And when you're there, of course you want to be social. Of course you want to get together. Friends you haven't seen in a while. Friends you've never met yet. And they should. And every kid on campus should enjoy that experience. But I think the kids are actually more educated than we think because they do make good decisions. They've lived with this all summer long. You see them. They do follow the rules. Once they're told what to do. Now, you're always going to have your outliers, of course. You're always going to have people that are going to say, that doesn't apply to me. But I think at UConn, I think we are, like Danny said, we are a team. We are one big team. And so far, our team is winning. And if you look at the numbers at UConn, they're not even comparable to any place else in the country that you read about. So we just got to continue doing what we're doing. We don't have to reinvent anything. We don't have to, all of a sudden come up with a new strategy, come up with a new plan. Hey, we've been doing this, but from now on, let's do this. No, we just have to stay the course. And that, to me, is the biggest message. Even though it's a great weekend to be out, partying, having cookouts and whatever, the main thing is understand this is not business as usual. Continue doing what you've been doing. There's a reason we're the best in the country at what we do, both in basketball and in beating this COVID-19. So my advice would be have a great time this weekend. Enjoy your friends, your family. Do the things that make you happy. But at the same time, continue doing the things that have put us where we are, the best in the country at what we do. So thank you, Governor Lamont. Thank you to your administration. Thank you to all the doctors and nurses and first responders and all the essential workers, because all of you combined have gotten us to where we are. And I'm proud to say that I live here.
That's great, Gino. It is a team effort. And Dan, I appreciate your thoughts, and be smart. I don't know if you guys can split any time you want to or stick around and take a few questions as you can. I'd love it. But Max, over to you.
Channel 3 Eyewitness News.
Good afternoon, everyone. Will there be any extra patrols this weekend to make sure large parties and gatherings aren't happening?
Want to speak to that?
We know that our law enforcement, our public health officials, everyone's going to be on standby this weekend, working with our local communities to make sure everyone stays safe, as the coaches just described. Our state police has additional patrols in the Manchester area, which so far, since we've been doing them for several weeks now, have showed that, as the coaches said, our students in UConn are doing the right thing, staying safe for the most part, and that's why we're getting the results that we are.
And then, Governor Lamont, a question for you. What are your thoughts on Representative France's letter to legislative leadership asking them to reject your declaration of emergency powers? What are your thoughts on that?
My thoughts are that the leadership's going to get together, I think, tomorrow and vote to extend, if they do this, we'll extend the emergency powers for another 5 months, which is what we discussed with the leadership on Monday. I think, most of the folks here in this building know that, look, whatever I'm doing with emergency powers is specifically related to COVID, nothing else. There's plenty else we need the legislature to opine in and weigh on. I can tell you that Paul is going to be meeting on a regular basis with the leadership and others so they know exactly what we're trying to do when it comes to those executive orders. And we're doing this for one reason and one reason only, to keep you safe.
Thank you.
Telling our news media outlets that both Coach Auriemma and Coach Hurley have left the press conference. Would like to thank them once again for their participation. We'll move along to News 12 Connecticut.
Hi, Governor. So if we can expand a little more on tomorrow's meeting, there's been talk about, if the Republicans have issues with particular executive orders, that maybe the legislature could revisit them individually in a special session. Matt Ritter brought that up yesterday. What's your thought on that?
Well, I hadn't heard that idea, but I do think it's a lot cleaner to speak with one voice. I'm going to do everything I can to keep the legislature involved in what we're doing, why we're doing it. I'm not sure you want everybody debating each and every executive order, sending a mixed message. Should we have a mask rule indoors or not indoors, or in one part of the state, not another part of the state? So I think what we're doing right now makes a lot of sense. I think it's working, and I'm trying to really narrow what I do just to public health.
So are you suggesting
I'll also add for a second before you jump in. I think the message that went out by the Democratic legislative leaders was extremely clear, that this governor has taken these emergency powers and has done so responsibly. You've seen two coaches, Coach Auriemma, Coach Hurley, who spoke directly to it and saying that we as a team in Connecticut are succeeding, and we're seeing what is going on across the country. This virus is still here. It is still prevalent here. Without these powers, Connecticut will not be as safe as it is today. It is clear. And going back to Representative Frant's letter, the question has to be, what about the powers and what about the EOs that the governor has put forth to keep the people of Connecticut safe that he doesn't like? Does he want people not to wear masks? Does he want bars to open? Does he want large gatherings to occur that makes Connecticut less safe than what it is right now? The question has to go right back to those individuals who are writing the letters, who are outside, who are picketing and such. Is it important to keep Connecticut safe? And the answer is loud and clear, yes. And that's what we're going to be looking to do, and we'll be in front of the legislative leaders tomorrow. And if they have any questions then and after a potential vote for tomorrow, this administration will continue to answer it as we have done since March.
So just to clarify, though, that if there was some sort of push to put particular executive orders to a vote in a special session, you would oppose that?
The governor at no point said he opposed it. That's the purview of the legislature if they want to go forward and do that. What we're going to do and what the governor is going to continue to do is keep the state of Connecticut and the residents safe. And we will do that judiciously, we'll do that responsibly, and we'll do that in coordination as we have done and as stated by the legislative leaders on the Democratic side continuously with their support and on their behalf.
All right, thank you guys.
News 8.
Governor, we've been talking about the students going back to school, but what about the teachers? We're seeing small numbers of teachers testing positive or put into quarantine. How will this rapid response team help with the teachers?
Look, I think the rapid response team, first of all, the teachers can go to a federally qualified health center right now, get tested anytime they want to make sure they know they're safe. As they know, we're providing the masks, disinfecting, everything we need for that. And I think going forward, this rapid response team, if we find there's somebody who's symptomatic in one particular class of 24 third graders, we'll be there, we'll be able to test, we'll be able to provide the quarantine and all the protocols we need to keep that class safe, that teacher safe, and that school safe.
All right, and the travel quarantine, the travel advisory, 14 days coming into Connecticut from now more than 30 states. Yesterday at the airport authority was asking for maybe in lieu of that a negative test. If you had a negative test, then you might not need to quarantine. Would you consider loosening it a little bit, or is the timing right?
Look, I'm always willing to make changes as circumstances change, and I'm looking down at Florida and Texas and California. Their infection rates are dropping quite a bit. Probably they're still in our quarantine zone, but a lot less infectious than they were just 2 weeks ago. So I will take a look at that.
Thank you, Governor.
NBC Connecticut.
Hi, Governor. Matt Austin with NBC Connecticut. First, just wanted to ask you about the rally that took place outside the Capitol today about reopening the state, and want to get your reaction to two big concerns that they had. One is that this just seems to have, in terms of all the rules that are in place right now, that they've gone on for a long time, despite our current infection rate being so low. So I guess there was some frustration that, how long is this going to go on for? What is the game plan?
I'd say the reason we have 95% of our state open, and stores and restaurants and everything except for bars and some big indoor venue type events is because we have been careful. And you look around the rest of the country and they opened early, and now it's South Dakota, North Dakota, and South Dakota had the motorcycle thing, and Iowa had the football, and they've had to start closing down again. We haven't had to do that. And we've got about 86% of our economy back. Our GDP is one of the strongest in the region. We have more of our economy open than anywhere else. But just because it's open doesn't mean everybody's going back all at once. It's a matter of building people's confidence. And you do that by staying strict about following the mask rules and the things that have kept us safe for so long now.
And just a second, there was a feeling, at least among some of them, that the rules have created somewhat of a system of winners and losers, with some big box stores basically, almost back to normal in terms of operations, but some smaller businesses are struggling. In fact, some still remain closed. What's your response to maybe that dichotomy?
Well, I'd say two things. One thing that has happened, given COVID and given the stay safe, stay at home, is the online retail. Amazon and Walmart are going gangbusters. And I have a feeling that's going to continue even after COVID. That said, support your local store. They bring a lot of life and heart and community to your Main Street, and I like to go to those local stores. I hope you do too. Go to your local restaurant. I like to eat outside myself. I just think it's what we do as a community.
And just real fast, has the surge testing, has that been deployed yet?
The surge testing, where's this? In the schools, you mean? That we described? Correct. Not as yet. Yeah. We're rolling that out right now.
Yeah, and just to be clear on that, we know our local school districts have put immense amount of time and effort into planning for safe reopenings, and in many cases that has included planning for the possibility or the likelihood that we will see some cases in schools. So many of them already have testing partners and plans set up. This is really to help fill any gaps that exist, or if a school district, when they work with their local health department, they conclude they need some additional help, that we'll be here to step in and help provide additional testing resources.
Thank you.
Fox 61.
Hi, Governor. This question is for you. The NCAA is looking at using Mohegan Sun as a bubble site for college basketball. Have you been involved in those conversations, and do you think that's a real possibility?
I've heard of some preliminary discussions. I can't say as I've been more involved in that, but I think it's a possibility. Look, I've seen what the bubble has worked down in Orlando. I was shocked. I didn't believe it. I thought basketball was going to be incredibly risky, but they followed those protocols very seriously. They're playing within that bubble, and that's made a difference. So I'll take a look.
Unmute. WTIC 1080 News.
Josh, can you provide me details of the rapid response team? Is that how many people were involved, and is this something the public can call in, or is this something that the state will disperse?
Sure. This is in partnership with the local health department, so this would come in through them. The way it'll work, if there are cases in a school, is the school district will work with their local health department. They'll initially decide what's the best course of action, because every circumstance is going to be unique in terms of number of people involved, the contact tracing, et cetera. So this is really, if they need help, they'll call the state DPH and our epidemiology team. They'll go through the case, and if they think more resources are needed, then we'll bring in additional resources.
The Associated Press.
Thank you, Max. Good afternoon, everyone. Governor, are you going to be working with any of the surrounding states to try to make sure that the beaches don't get too crowded this weekend?
I think what we're doing, Sue, is making sure our beaches don't get too crowded and making sure that Rhode Island and New York stay on their own beaches. I think that's the appropriate way to do it. So as you know, Katie Dykes has limited parking at a lot of our beaches just so we can maintain a little bit of distancing there. Certainly we've urged out-of-staters, to stay on your own beaches. I think there's even a cost differential now to go park at one of our beaches if you're an out-of-stater.
And also, is Connecticut going to be complying with the CDC request to expedite licensing and permitting on the state and local levels? So there's can hear my echo, sorry. So there's so COVID vaccine distribution can begin by November 1st. And what do you think about that whole thing?
Well, first of all, we'll work with CDC. We'll be ready to go if they actually do have a vaccine that's tested and proved, and we'll be ready to have that distributed and do all the protocols we need. I'll say on a personal basis, it's one thing to say you have a vaccine, but you want to make sure you do it in a way that people have confidence, that you've done it right. I appreciate Operation Warp Speed, but slow down. I want to make sure that when we do it, people have confidence, your doctors have confidence, your nurses have confidence, we have confidence in the CDC. This is something we should do. It's the right thing to do. We've had some problems in years past when I was growing up and in college with vaccines were maybe rushed a little bit. We're not going to let that happen in this country.
Thank you very much.
The Hartford Courant.
Hey everyone, this is Emily Brindley from The Current. Governor, I'd like to ask some follow-up questions on your comments about vaccine distribution. Can you explain where the state is in its distribution timeline or its distribution plan? And can you talk a bit about what that distribution plan will be like?
I don't think I can at this point. We're just getting those guidelines, as I understand it, Josh, from the CDC right now. I'm going to be meeting with all the epidemiologists down in New Haven on Tuesday, I think it is, talking about the possibility of this vaccine, get their smartest medical opinion on what they think an objective timing is that we could get that out safely. And in the meantime, talking about therapies and tests that they're also working on. We'll probably be able to talk about that more publicly on Tuesday at our next press briefing.
Okay, thank you. And I also wanted to ask, as we're moving into the fall, do you expect to see a fall wave? And if so, can you explain a little bit about how severe you think that wave will be?
All I could do is tell you what Zeke and Scott and Albert Coe have been explaining to us, which is we remember from the Spanish flu in 1918, there were consecutive waves. The second wave was more severe than the first, if memory serves. When it comes to what we're thinking about in November, December, the traditional flu season, we worry a lot, especially if people are not getting their traditional flu vaccine, which I think is so important, especially this year, because flu symptoms and COVID symptoms are very similar. And if there's confusion, in our emergency room, confusion in our hospitals, you could have, you could fill up much more quickly than you need to do. So I think we worry that the flu season could at least create a perception of COVID is increasing. And if we don't have the flu vaccine, we're not going to be able to know the difference.
I definitely hear your concerns on flu there, but can you talk a bit about whether you think there'll be a coronavirus resurgence in the fall?
All I can tell you is that the experts have said if we're going to have a resurgence, it probably would be in that November, December period, just because that is a flu season. COVID is a type of flu, and they probably are going to go hand in hand if it happens at all.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Governor, would you say that some of this ultra-conservative criticism about reopening the state seems to be parroting politically charged statements from the White House?
Look, this is happening in 50 states, and everybody's got the same flags and a lot of the same rhetoric. So, I think there is something there, and I don't think it's helpful. And look, I'm not closing down the state. As I said before, 95% of our state is open. COVID closed it down, and COVID is giving people concerns about how fast they want to get back into business, and I can understand that. I've been the guy sort of a champion in trying to get people back to school safely. I'm pushing a little bit there on that front, so I'm not the guy slowing it down. But I do think it's better when officials from the highest level, the governor and teacher and coaches all talk with one voice. It makes it a lot easier.
What do you want to hear during this meeting of the 10 leaders and committee leaders tomorrow?
No, I won't be
Assuming
there.
You're going to see it. No, but it's all right. So you're not going to watch it at 8 o'clock in the morning?
Is it on TV?
Yeah, it should be on CTN.
I'll probably watch it. Thanks for the heads up.
What kind of debate would you want to see?
Look, we had a very constructive meeting on Monday, and I thought we had sort of a broad consensus on what we wanted to do. So I'll be curious to see, A, what has changed, and I did get some feedback that we can do an even better job of involving and informing the legislature what we're doing, why we're doing it, and what our rationale is for doing that. And I always appreciate their input as well. And we're going to make sure that we're in a little less of a rush situation now than perhaps we were, in mid-spring. So I think we'll be able to do a good job of collaborating with the legislature on this.
Thanks. And Governor, this is a little farther afield, but were you acquainted with Tom Seaver at all when he was living in Greenwich?
I did meet Tom Terrific a few times. It was a privilege. He was playing squash and racket sports with all the same intensity. He used to, pitch a baseball. And I can't say I knew him well, but I was always proud to say I met him.
Thanks, Governor.
The Day of New London.
Hello, Governor. I was interested in your response to the letter you would have gotten today from Senator Austin, a couple of representatives in southeastern Connecticut, where she's asking you to issue an executive order that would require healthcare workers to report suspected COVID illness to their employer and then to quarantine and not to report to work. And this is, of course, a response to the outbreaks in Norwich, and just generally, how concerned are you about that situation?
Well, broadly, I think this is what we're doing right now. This is CDC guidance. This is our Department of Public Health guidance. If you're sick, stay home. Do not show up at work. If you have a pre-existing condition, stay home. Do not show up at work. Wear the mask. I mean, a lot of protocols were not followed, but that doesn't mean those protocols weren't in place and those rules weren't in place already. Anything to add on that, Josh?
No, I think that's correct. I mean, we do have, as the governor said, DPH already has guidance out that, for all healthcare facilities to screen employees for illness. And I think at this point it's common sense across everyone in our state, in our country, in our world, that if you have symptoms, don't go to work. You need to stay home and you need to protect your community, and that did not happen here. But that said, we'll look at the senator's request and see if there's additional measures that we could take to further clarify that. But at the moment, we know there are already requirements on our healthcare facilities to ensure that there's additional checks in place.
So would you consider an executive order, or you don't think it requires such an order?
We'll look at it since we just received the letter this afternoon.
Okay, thanks.
The Connecticut Mirror.
You sure, Max? Anyway, Governor, one of the complaints that were raised today at the rally, and it came up in one of your earlier questions, was there a disparity in the treatment of big box retailers versus small? And my understanding is it was about content. It was about things that are deemed essential: food, medications, hardware, and so forth. Are there any in your executive orders that discriminate against small retailers versus big box retailers, as was stated today?
No, I think you answered your own question. I mean, obviously, if you had food and other essential items there, you were open for walk-in traffic. But every small store, unlike a lot of our neighbors, they were open at least for pickup. So we tried to do that as sort of a lifeline until we could get the stores open. We got our stores open, I think it was May 20th, if I'm not mistaken, for walk-in traffic. So I think we did that cautiously. We did everything we could to make sure our small stores could keep going during the peak of the pandemic as well.
And I'll also add to the fact that we've had hundreds upon hundreds of these small stores who have self-certified with the state of Connecticut that they're following the COVID-related guidelines. So first and foremost, I want to thank those small businesses and those small stores for not only adhering to the rules, but being the leaders as well.
So what can you tell us about easing up the restrictions that are also there on, obviously, bars, large events such as the games that Mr. Hurley and Mr. Auriemma are going to be coaching?
Well, I'll start. I mean, I mentioned, Paz, that Florida, Texas, Arizona, the infection rate is going down there. They had to reclose their bars, and they did that in mid-June. The places where the infection rate is beginning to pick up now are places like Iowa, or Iowa State. They're having football games. It's like North and South Dakota, where bars are open, and you had the Sturgis motorcycle event with hundreds of thousands of people. So I think we've got a pretty good balance going in the state right now, and I do think it's working. In terms of next steps, obviously getting our schools back, getting our colleges open safely are a big priority for me. And then sometime this September, I think we'll have to look at the restaurants as things get a little chillier outside, and outdoor is not the perfect option.
Well, we're into September, though. I mean, what can you tell the restaurant people about what would be the metrics that you would look for? Obviously, the infection rate is good. So are there other metrics you can point to, whether they're in Connecticut or in surrounding states, about when you will feel comfortable for bumping restaurant capacity, say, up from the current 50% to, I don't know, 75% or whatever?
I would say right now, with the outdoor dining, it's working very well. Every restaurant I've gone to, and I go to a lot because I like it, 95% of the people want to eat outdoors. You may say, all right, you're answering your own question. You don't have to have a restriction on indoors. But I think that's something we're going to confront as the weather changes, later on this month. If you're asking me at 3%, you can go indoors at 75%, but at 5% you can't. I don't think I have a direct metric on that as yet. But right now I think our instincts have been good and people understand where we're headed.
Thank you.
CT News Junkie.
Thanks, Max. So, Governor, the Department of Social Services put out a memo this week that says that it's not going to be distributing PPE any longer to Medicaid recipients and PCAs. Why have you guys made that decision?
Why don't you take that?
Yeah, so the PPE that the state has distributed since this pandemic began is under a program called mutual aid. So where a healthcare organization or someone who is in need doesn't have the supplies, the state is essentially the backstop. We're now at the point where the supply chain for PPE is stabilized. We know in talking to the vast majority of healthcare providers, whether it's hospitals, nursing homes, that they're back in the position where they're able to procure their own. That's the way it's supposed to work. These are private businesses, and we expect them to be able to provide for themselves. But that said, the state still remains here as that backstop, and we have a process in place through Department of Public Health, where if a healthcare organization is running short on PPE, we can get deliveries out to them from our warehouse. We do that from time to time, but that's become very rare. And so it got to the point where these mass distribution events were no longer needed, no longer efficient, and so we'll now be on standby, as we have been throughout, to meet specific needs in specific facilities if they arise, but it's not a big issue right now.
And it says that the guidance from the CDC and DPH says that cloth masks are appropriate for PCAs and Medicaid participants. Is that accurate?
Well, we've been following CDC guidelines on PPE throughout. We can, if there's a specific case that we want to, you're looking for more information on, we can connect you with the Department of Public Health.
Okay. Thank you.
The Waterbury Republican American.
Thanks. We've heard Sturgis mentioned a couple of times. Have there been any COVID-19 cases in Connecticut that have been traced to the Sturgis motorcycle rally?
Not that I know of. Either of you guys?
Hasn't come up.
You didn't go to that rally, did you?
I was not there. No. Hasn't come up, Paul.
Okay. Governor, you mentioned a meeting next Tuesday of epidemiologists. Just what particular epidemiologist, well, try to get that one out, who will be attending that meeting?
Well, Dr. Albert Coe, who I think you remember helped lead the scientific team on our Reopen Connecticut committee, is getting me together with some of the other healthcare leaders in the greater New Haven area. And I asked for this meeting. I think it was a team that worked together very collaboratively, by the way, right during the peak of the pandemic. I think they did a heck of a job. And as I mentioned to you before, there are all these magic therapies that are coming out there right now. The Abbott Labs 5-minute test, the vaccine, the magic vaccine. Is it going to come? Is it going to come in time for the election or come in time for the end of this year? We've got the saliva test and pooling. I just thought this was a really good time for me to get a refresher in terms of what is possible, when is it possible, how can we roll that out safely? And they wanted to get an update on where we were on reopening.
Okay. And are you hearing from any experts expressing doubts about a resurgence of COVID-19 occurring in November or beyond?
I don't think anybody is speaking with great exactitude on this. I think the instinct is if we are going to have a resurgence, November will probably be a pretty tough month. Obviously I was worried about April going back a few months because I thought that's when we were cresting. I think we're much better prepared than we've been before. We've got the testing capacity. We got the masks and gowns. Our hospitals are ready to go. And let's hope to God this doesn't happen.
Okay, and just what additional resources would these rapid response testing teams bring? I imagine testing, but you mentioned, or Josh, I believe, mentioned in one of the responses that, there would be additional resources. Could you elaborate on what that might be? Personnel, testing supplies, I imagine?
Go for it.
Yeah, as you suspected, Paul, it's testing. So it would be, a mobile van in some cases with staff and all the necessary test collection kits to be able to help bring surge capacity to a town that might need it. So similar to what we did in Danbury a couple weeks ago, where we saw that flare up, we worked with the local partners, the federally qualified health centers there and other partners to bring in some additional testing on very short notice and really help get our arms around that. It'd be a similar model.
And are you guys getting close to issuing an alert similar to the one that was issued for Danbury or Norwich?
No, yeah, asking if there's an alert coming for Norwich. No, we think in Norwich, the evidence so far, and the team is following this very closely, the local health department there, the municipal leaders, and our State Department of Public Health is in regular contact multiple times a day with the community there. At this point, that seems contained. That does not appear to be community spread. It seems to be contained to this particular nursing home and perhaps some bleed over into the local hospital as well. But it doesn't appear any evidence at this point that there's a community spread.
Okay, thank you very much. Those are my questions.
Connecticut Public Media.
Good afternoon. When it comes to restaurants, we talk about capacity and percentages. Is there any opportunity for, in the future, to possibly reopen them with saying, like, as long as you can keep tables 6 feet apart versus a certain percent capacity going into the fall, as long as they can abide by CDC guidelines in terms of spacing, allow them to have as many as they can fit?
Yeah, I think we're going to definitely be looking at that.
That's all I got. Thank you.
All right, Max has given me the wrap signal. I just wanted to have a little fun on the eve of Labor Day. One of the great things I get is dozens of letters from you, and I like to read the happy ones. Here's one from Dylan Albert. Dylan says he's a fourth grader at Duffy Elementary School in West Hartford. I thought it'd be a cool idea to write you. I wanted to ask you, what's your favorite part about being governor? And I'll tell you, it's getting letters from young people like you, Dylan, that love this state and happy to be here and looking forward to going back to school. And as you write here, stay safe. And remind your sister Isabel to stay safe as well. And I got one other letter. I just thought it would be kind of nice. My name is Adeline Lane. I'm 7 years old. I have a question about COVID. When will COVID go away? When will COVID go away? Addie, it doesn't just go away, but we can help push it away. And we can help push it away by wearing the mask and being especially careful and keeping the distance, doing all the things you've heard us talking about along the way. And I know you're very young and it doesn't seem like much fun, but we're going to get through this just like we've gotten through a lot of other tough times in our country. And we do it by working together. And I love your letter as well. And I hope you both, Adeline and Duff, have a really great Labor Day weekend with your family, a nice barbecue, and also remember Labor Day is about a lot of folks we now call essential workers who are on the front lines making a difference for the state every day during what's been a pretty complicated 6 months. Enjoy the weekend, everybody, and be safe.